let's be honest, we all have a ticket on the train.
True.
We're not going to get out of this life not dying. But for people, their ticket is punched. This one particular woman who I just adored, she had so much humor about who could and couldn't come to her memorial because she was still really mad with her ex who dissed her. There's some way where there's just a very deep humor. What else can happen, really? There's something so human about telling the truth and then laughing about it.
Two different doctors come together and talk about the most difficult questions in medicine. This is Puzzle Exchange here in San Francisco. I'm so happy that Elizabeth, you are able to join us today. You have been in the field for more than 40 years, working with cancer patients and other patients going through deep trauma. Because we reach out to you so to share about breast cancer, and it is because of this topic you feel like you want to share more, and I'm very honored that you said yes to this.
I don't think we can talk about it enough and reach the patients, their families, their partners, their children, because the stories are what connect us and make this disease process real.
You work with patients via different stages of their life, from just discovering it to even for a couple cases that's going through the end of their life. And that has a lot of impact on yourself as well. You are very openly experiencing all that and opening up.
Thank you. Let me start with a story. Each woman and man can tell their story. Breast cancer does not belong just to women. Many men also are diagnosed with breast cancer. All of a sudden, the ground of your being is quite different once you get that diagnosis. And from the moment that you either feel a lump or you have a mammogram or something is not going well in your body, your life changes. Oftentimes, it's filled with a lot of fear. What will happen? A recent diagnosis with a dear friend of mine that came out of the blue is that she was at 79 having a lot of night sweats, something that she was sure that she was completely through in her lifetime, and that she had taken hormones earlier in her menopausal years, but had stopped. These night sweats were bothering her, because she'd wake up completely drenched. And so she decided to give her gynecologist a call and say, I'm really considering wanting to be back on hormones because I'm having these incredible night sweats. And so that was the beginning of 1 week. Her physician said, let's have a mammogram first. It had been a couple of years since she'd had her mammogram. Sometimes when you're older, you're not thinking about this anymore. So she went in for her mammogram and then got a phone call. Come back. We want to do another one. While you're here, let's do an ultrasound. They found many little dots of cancer. Within 10 days, she had a mastectomy at 79. Total, complete shock. Going, how does this happen? She just felt like she got slapped, and it was very rapid. Oftentimes, when breast is taken, lymph nodes are also taken, which sometimes is more painful than the mastectomy. She's just blown away with how long the scar is around her back and up through underneath her rib cage. It's been about a month.
Mhm.
She feels extraordinarily lonely. She's still in shock. She says, how did this happen? I don't understand it. And then, like many of the stories that I have heard and know about, during this time, she found out that her mother's sister, her aunt, had breast cancer and was never told. So nobody knew about it. When you talk about the secrecy that happens, it happens within families, that there may be a family history and it's not told, so
Yeah.
that the next generation of women and men don't have a chance for the genetic testing.
Yeah.
And that's so much like what you just shared. It's like someone who is at their 70s getting diagnosis with breast cancer and having to still go through this, finding out that they have a family history about this, like that she never know. So there's a huge
Mhm,
silence about nobody talks about this topic. And then like she herself had to go through like the physical change,
mhm.
emotional change of discovering that this is so much to take on at the
Right.
age of like even 70 years old, 70, more than 70 years old.
Yeah,
So
78, yeah,
Then
and now she's facing she doesn't have to do radiation, she doesn't have to do chemo,
mhm.
but they wanna put her on a hormone suppressant for the next 5 years. So she says, "I will be 84 when I'm done with that." And
Yeah.
from all the research, and she's been interviewing people that have taken different medicines, she goes, "I'm just not sure, particularly when there is maybe only a 2 to 4 chance of recurrence if she takes it. So the statistics might not be good enough." Here she's trying to make a decision about the post-surgery when I don't even think that she's through the shock of what has occurred, plus the
True.
pain that she's still in.
Does she still have the night sweats?
No, I don't
Mhm.
think so. Yeah, I don't know. No, she's just got the shock and confusion. So
Oh,
that's one of the first stages that everyone goes through, the shock and the fear of what will happen from this. Oh,
okay, it's so many different multiple layers of changes to your life.
mhm.
And before we get into that, I also want to introduce Dr. Depp. So you are acupuncturist who founded a puzzle acupuncture,
yes.
and you have 17 years of experience working in as a acupuncture
TCM.
TCM doctor. And then you also have a family member who is diagnosed with breast
Yeah.
cancer.
Yeah, my sister-in-law was diagnosed last year, and she's only 34. My brother and they don't have a kid yet, so they haven't have any babies, and now they just thought of, "Okay, we should start a family," and then discovered that she had cancer. While she was diagnosed, my brother was in California having a scholarship, like he had a 4 months of studies in Stanford, and so when my sister-in-law was diagnosed, my brother wasn't with her. So, of course, she was, shocked and lonely at the same time, even though her parents and my parents are with her, but still her husband wasn't there. She was really scared.
Like she's early stage when she
She
diagnosed,
Yeah.
and
One is she's early stage, but also she still need to go through all that, and because of that, they went through the process of doing the IVF just to get the embryos out, just to have some embryos saved for later, even though now she's done chemo and now she's doing the hormone therapy. So that's gonna
Mhm.
take another 5 years. So when she's probably when they really finally having the chance to have the baby, she's gonna be almost 40.
you have
And
another friend who is also diagnosed with cancer, and every time they're trying to have baby, like there's
the
the cancer coming back, and this
yeah,
is just like
and
Mhm.
constantly
Yeah.
impacting their
most
emotions, their life. You cannot plan something like that. You have so
Mhm.
much hope.
it affects their connection with their families, like my friend's parents, the in-laws, they're wishing to have grandkids, but every time she's trying to have a baby, the cancer comes back. She's
Mhm.
been fighting cancer for
Yeah.
probably more than 10 years, and that's really seeing them, it's really devastating because each time the cancer comes back and she almost die. And
Yeah.
now she's just, "I'm just gonna take care of myself. I'm not
Yeah.
gonna take care of what the in-laws are saying. What is my life is more important." And
Mhm.
now she's having more positive thoughts, and for the
Yeah.
past few months, she's pretty healthy, but before that, she was really devastated.
Yeah, and
Yeah.
sometimes those hormones that it takes to get pregnant and to stay pregnant is the very thing is jet fuel for breast cancer. Many women who have gotten pregnant and they've also been diagnosed right around the same time. So here they're trying to stay healthy enough for their baby and alive.
Yeah,
You
and
know, I think it's important to talk about because so many people, when they're diagnosed with breast cancer and sometimes just other cancers, it's like, what have I done wrong? Is God punishing me? All the different doubts. And it doesn't make any difference. I know people who have had no diet changes, having a very fat, rich diet. Maybe other people have been completely vegan, clean, still will be diagnosed. So it and it doesn't matter what strata of life that you live in.
yeah.
It happens across all cultures.
Yes.
Y-
Before last we talked, I did reach out to my sister-in-law and asking, like, how she's doing recently, and I think good thing is because we're Christians and she has a group of friends in church that will pray with her and let out her emotions. It's very important that she has those support friends, and the families are very supportive, so, she's
And
okay.
so one of the silver linings of this diagnosis is to build your support team, to let family members in, to let girlfriends in, to let extended families. Deb, she was so grateful that you even asked, that you're educating yourself about the impact that this is in her life and in other people's lives. And so that silver lining is I think there's many people that they're just with their doctors and their medical team and that's it. But it's very isolating because we need each other, particularly when we get really afraid or we don't feel well. I know one particular person that I worked with, she had her good friends go to treatments with her,
Mhm.
sat through the chemo, sat through the radiation. I shaved her head in my office. And another woman who was really into wigs. I would look out my office door to see her walking down the street. We named them all. I'm going, oh, yes, okay, she's coming today. Oh, she's coming today. That there's many different alternatives to letting yourself have a few personalities underneath your wig until your hair grows back. And there's humor. In some ways, there is just a lot of humor. People are willing to say how it is and not pretend.
I think it's really important to have a positive thought and open to it. I remember I had a patient in her 60s at that time. She had 4 tattoos on her thigh, 2 in each, and that was like a caterpillar on the rosebud, and then it turned to a cocoon, and then the rosebud bloomed into a rose, and then the butterfly flew away. And that was she was telling me in the beginning that was she was having cancer. Afterwards, she transformed and now she's cancer free. And she said the cancer was like a couple years before ago, and then she's just started to have different tattoos of of what she felt, trying to fight it and be positive. And she's happy and
Mhm.
feel she can conquer anything.
One of the very early breast cancer survivors who had a double mastectomy, famous writer, I'm not sure she's still alive. And she had double mastectomy with no reconstruction, and she tattooed her entire chest.
Oh,
It's like, here's my new identity.
mm,
So let's talk about this identity. Your identity changes. For women, it's like going, oh, I'm identified with my breasts. They're a symbol of my womanhood, my femininity. Some women have nursed, not nursed, their sexuality. What will their partner think? All those different things around who am I now? I see more women they're not doing reconstruction unless they're in their younger years of just being able to say, nope, this is me. This is my body now. But there is a big identity shift.
And it's quite because just hearing when you were talking about the wigs, and you also mentioned before people would tattoo their eyebrow, trying to find the fun from that. But just the fact your appearances change, you are losing your hair, you are losing your breasts. Like those are, as you said, like symbols of women. A lot of people associate that with who they are. This is
Mhm.
something you have to deconstruct about. Okay, who am I now? How can I go from that identity from the day that I got diagnosed?
And all those things don't come in order. At each juncture, not every single woman or man is going to go through a full mastectomy. And many might have just a ectomy and not even radiation or chemo. The treatments are so individualized at this point, and the genetic testing is so amazing. I'll tell you one story. It has a sadness, but a good story to it as well, of working with one woman who had the amazing different wigs. It was so much fun to see who she was going to show up as. But her father, so she was a BRCA carrier, and there's BRCA1 and BRCA2, which is a genetic makeup, which has a possibility that if you are a BRCA1 or BRCA2 carrier, you might be predisposed to
Mhm,
breast cancer, uterine cancer, lung cancer, just different cancers. Her father was the carrier. And so when she was diagnosed, they tested him. He was the carrier, she was a carrier, and then her younger sister was also a carrier. As a gift to her sister during that time, who was in her 20s, her
mhm,
sister went through a radical double mastectomy,
cool.
along with having her uterus removed,
Mhm,
fallopian tubes
mhm,
removed. She did freeze her eggs before she did this. So she survived. And I think she might have gone on to have her eggs carried by another woman. I'm not sure. She married in her
mhm,
late 20s. Her father and sister did pass on and very close to one another, but it was an incredible, deep connection that I had with her in this family.
Mm,
There was a knowing of how the outcome might be and that the trials just would not touch it. But the sister then survived.
that's so nice that she saved her sister.
Yeah.
and maybe we can share about the impact, like for someone who don't know, what happened to their body?
As I see it, when both men and women go through breast cancer treatment, they have a lot of choices of how they want to go through it. Some actually say, I'm going to ride it out. I'm going to use alternative medicine. I'm going to see which way it goes. I haven't seen that go so well all the time, but Deb, you know that
Yeah.
blending of allopathic and alternative, and you being so knowledgeable in
Yeah.
acupuncture and Chinese medicine, there's that choice. Again, each one of these choices is individual. Some of the things that are happening now, depending on the diagnosis, I'm not going to go through all the diagnosis because I'm not a physician and I don't want to misstate something that isn't right or offensive. But there are certain layers of diagnoses that need certain treatments. Early detection is the best way to go. And then if you do choose to have lobectomy, mastectomy, then you're sacrificing your body parts
Yeah.
in many disease process. I know people that they get a kidney from somebody. It's like we're in a time in medical history that we can actually do this. Some people, women in particular, who have breasts, men have breasts, but there's not that much to reconstruct, not as much to reconstruct. For women, women then can choose, do they want to reconstruct their breasts? And so that's additional surgery. So there's a lot of sacrifice of the body and surrender to go through it.
Yeah.
That
And
sounds quite overwhelming because it's not just there's a timeline and the things happens and it's so much choices you have to make
Mhm.
about your organs. And that it's
And
like
the organs are
something
on the inside. The
Yeah.
organs are on the inside, your breast is on the outside.
Yeah.
And thank goodness we have so many resources for prosthetics. Women who don't want to reconstruct, but there's prosthetics. There's swimsuits, there's bras, there's everything you need that will help with that. I know that I'm thinking of one particular woman, student of mine who, she's just gorgeous woman, very large breasted. She was diagnosed and she just says, "Oh my God, take them both. I don't want to provide a host for this to come back. I don't want to go through this again." And she did not reconstruct. I know so many women who don't reconstruct. They just go, "Why? Why? I'm done with that." But women who are younger, they want the vanity of their body and that familiarity will go through that. And they'll go through that well and beautifully. And it works. So there's identity choices all along the way. Plus, having to live with scars and some women, particularly men, you've tested positive for BRCA1, BRCA2, of going, "Oh my goodness, let me be responsible for my children." And because it can go to men as well as women, and how to make sure that is knowledgeable. And I think that is suggested so much more now is, are there other family members that you want to inform? Because the other thing that happens is that women will go, "Okay, I'm going to do my breasts. I will reconstruct them. Then I will give up my ovaries and my uterus." So it's not just step one.
Yeah, it's really a lot.
But
The patients I see, there's side effects from chemo or radiation. And even with the surgery, there's limitation of movement because of the
Mhm.
scar. Or like some, you might have neuropathy or they have tinglings or numbness on the fingers. Like anything can happen.
Lymphedema happens.
But yeah,
So
swollenness.
yeah, so it's often that you need to find a PT that will help with the lymphedema and train you how to release that. And also, if you're going to be in an airplane, you're going to be in a sleeve.
Yeah.
little things changes, like all
Yeah. So
little
there's
things.
always there's just one more step.
And you mentioned about working with different departments. How would that usually work when this happens to someone or like your family members?
If
Who's
I
the support team around you?
Sometimes I'm in from the beginning because we had a breast cancer specialist who would refer patients to me. I also have oncologists that would refer patients to me if I got in at the beginning or somewhere along the line. It's building the relationships with your healthcare workers. For some
Mhm.
people, it can be more traumatic than others for whatever reason. I'm thinking about one patient that I worked with a lot. She had a lot of early childhood hospitalizations for asthma. So it was like she was traumatized by being in the hospital again and also being a patient, i.e., victim, feeling that all that early experiences, traumatic experiences, were re entering her trauma treatment.
And like in
I don't think
Chinese
I am,
medicine,
but to bring your team together, build your team, build your tribe. I also see that people have more support groups. When you're more through the treatment, there are gyms that support just people working through breast cancer. It's so deep in the muscles, so deep in the structure of our physical bodies to build your strength back.
yeah, the patients that come to you, would you trace back to their trauma, like from diagnose, but even earlier, like you said, with this, she was having childhood and she was going to the hospital during her childhood. In Chinese medicine, we think that a lot of cancer conditions, especially with breast cancer, it's related to they have anxiety or depression. And we say it's like the liver energy stagnation that will cause the
Mhm.
stagnation, and like the dampness or the chi will be stagnate, and that will cause cancer. So it means that before you got diagnosed that having cancer, you might be already a grumpy or very easily depressed person. So that's why okay, so I'm asking because when you have these patients, if you trace back, do they have these like kind of signs of being depressed or before being diagnosed of cancer? I know we said that it could happen to anyone, but is there a higher level that might cause it?
Is there a reason it
Not for
happens?
people.
And should people feel shame about it?
I always take a good history, particularly around traumatic events in people's lives. There does seem to be some early childhood neglect,
Mhm.
abuse, unstable families, early losses, things like that, that can happen, or very deep
Mhm.
suppression. I will be personal here. My own mother died of pancreatic cancer at 60. And I would say it was a good amount of suppression. This was in the, let's see, the 80s, early 80s, but she was raised in the 30s, 40s, 50s, where women didn't have much of a voice
Yeah,
or a way to really be in the world. And so I think that's a lot of what happened for her, besides maybe too much alcohol and nicotine, which was part of that culture. It was like, that's just what was going on in the 50s. You had your cocktail and that's what was happening. For me, I've had to put together the suppression, that there wasn't a place for the creative use of emotions, creativity, expression, or help. We still have trouble asking for help. One of the positive sides of this is that you do ask for help, that you can't do it alone. We can't do it alone anymore.
true. And it's good that people now are more open to go to a therapist to talk about whatever there's going through, and there's an outlet for
Mhm.
them. Yeah,
Yeah.
Yeah, and we talk about how there's such a huge silence and that it often comes with shame. And it's partly genetic, you partly it's like your lifestyle, something could happen like early childhood, but like the I think that just the amount of shame, and that's also blocking people from asking for help. And you are at a position where everything turns physically, mentally, your family dynamic, are you going to have kids? It's impact in every other way. I think I wasn't aware before talking to Elizabeth, before talking to you, there is so much silence around this subject. Like this is like how did it happen and how much people are trying to avoid this subject even?
And you have to appreciate that when this diagnosis comes, it's inconvenient. You may be planning a big trip and you have to wait until you get home to get the diagnosis, or things get disruptive. And it really is at 180. You just, your whole life changes. When I know so many women that they've got young children, they're trying to keep their profession going. If they've got their profession, men aren't going to talk about it at all. This is a woman's disease, right? No, it happens. And men go, how did this happen? But you look within the genetics sometimes that there's just enough there, and maybe a lifestyle or early traumas can contribute to it.
do you have lots of men clients that come to you that had breast
But
cancer?
very occasionally, they want to keep it to themselves or share with their wives, keep it within the medical
Mhm.
model,
I think
you
it's
know. So
it's even tougher for men to open up, especially with they have breast cancers. And yeah, I've never had any
sure.
patients with that.
Yeah, and even with the surging of prostate cancer, sometimes men's journey of that they get prostate cancer, women get breast cancer, and there's a lot of shame. There's just a lot of shame, a lot of secrecy.
I
No,
think
just want to make it through.
My dad actually got diagnosed with prostate cancer earlier this year, and he's also 79, but
Mhm.
he had, like, colon cancer a couple years ago, but he gone through it, it was okay, and this is non-related to his colon cancer. So the doctor said as his age, they don't recommend to do a surgery. He took 2 shots and the levels went down, so it was,
Right.
like, okay, but like, he did talk this he was talking to his friends and then chatting about this, and with his age, this is quite common with prostate conditions, and some turn into prostate cancer, and so he
Mhm.
had other friends did did the surgery, but the outcome didn't came out really well, so they were just chatting about it. From his case, I feel like he has a much open mind about talking about this through with his friends, and they don't mind talking about it as well, so
It's great. It's
yeah.
great. And there's a couple other things that I'll mention. I did it in the beginning, but I'll say it again because I had a colleague who was one of many children, and she was diagnosed in her 60s. And once that was happening, it was found out that her aunt had breast cancer, but it was never spoken of.
Unspoken.
That genetic testing could have been done.
Yeah.
And it is happening more and more, particularly for people who have children or siblings. So when, Jenny, you're talking about the secrecy or the silence, it's like people just go, oh, I'm just going to take care of it myself. And it does impact other people.
I think when I know about your dad's diagnosis, I was surprised how light he felt,
Yeah.
even after getting
Well,
it,
he's
and just like having a very positive like attitude towards it. It's like it happens, and I'm just going to go through it, trust the system to.
they were a bit worried in the first few days, but after the doctors tell him, like, his the level he's having, it's not as serious, and there's not really a tumor. It's like a very tiny dot. They
I
think
see.
it could be cancer, but it could not. So they thought that not doing any surgery, just the injection, and that went down. So for him, he's lucky with that. Yeah.
Yeah, early detection is really important. Please see your healthcare provider, have your prostate checked, have your mammograms, do your own breast exams, early detection. Like my friend who was just diagnosed and went through surgery within 10 days. She had no idea. She was just having night sweats. Her breast didn't feel any different. People are going, "Oh, it's been 5 years since I had a mammogram or had my teeth cleaned." People don't do healthcare. They just don't.
One is also but healthcare is so expensive in this.
It's so hard on us.
How
And
early, what age, and how often should people go
Well,
through these checks?
when if for a mammogram for an ultrasound, you should do it after, like, your 30s. For a mammogram, for example, in Taiwan, after you're 40, you can get the mammogram every year.
this
Check it out.
I'm doing a mammogram every year.
Yeah.
And
Yes,
no,
and sometimes
so
I did find some nodules, but it's just benign. You don't need to
Mhm.
worry too much, but just to be
Mhm.
safe. I also did a gene test after my dad found out he has colon cancer. I think my genetic I don't have that gene that is bad, so I think it's fine. I'm just
Mhm.
eating cleaner should be okay.
Mhm.
Besides doing those tests, there's self-tests too, right? Like you can check
True.
your breast to
Yeah,
feel if it's
there's a lump.
lump or not. So there's
Mhm.
plenty of just like something simple that people can do at home.
And it's not uncommon that some women say, I just have thick breast tissue, so I can't feel anything. And so it's the mammogram. Now we have incredible technology. I was on an advisory board for women's health, and we were fundraising for the 3D tomography, where you can look at the whole breast.
Both, yeah.
Yeah, once that 3D tomography really came on board, which now most places have, during a lot of that fundraising and keynote speaking and educating people and being able to hear women's stories, because women and men have a lot of stories, and it's what saves us.
What are some of the can people find goodness or benefit from going through breast cancer? And what are they?
I think the first thing is it's very humanizing. And there's also something about going, oh, wow, I'm suffering in a completely different way, but it's very real. Of course, you're working with fear a lot, fear of which way is this going to go. And so being able to learn how to meditate a little bit, walk in nature, be in nature, appreciate what you do have, appreciate the connections that you have with family. And it could be just one girlfriend. It could be one particular group where people are talking about the challenges that they have. There's writing groups, there's dream groups. Women are horseback riding out on the beach, all cancer survivors. There's lots of opportunities to begin to really appreciate your life and be grateful. And you make really good friends on the most part. What was I going to say? I There's a garbage can being brought up in the air right now. Distraction.
No, I think like
Your
what you meant.
caretaker, your caretakers are helpful and kind. And particularly when there's depression and anxiety, you can get help and support for that. Your therapist means everything to you. Let me tell you, it's been a privilege to work with people through their cancer.
So it's almost like knowing the fact that there might be a chance for so close to death, because that's what people they will have that in mind,
Right.
that you learn to live again because
Mhm.
it's so close, and then
Mhm.
reevaluate and then looking like it's like knowing what's more important to you than
Yeah,
ever.
and things happen where you just go, I wasn't liking that job anyway. It can be a positive pivot. Some women will go, oh, we're going to go ahead and get married. It's yes. Or after sometime, I'm going to adopt that child. There's choices that can come out of it that are really positive. I'm going to start dancing again. I'm going to begin to paint. It's like those questions that maybe you have put off, it brings it right in front of you.
It's a chance to do the stuff that you've been putting off or doing something that you never do. And it's almost like a new life,
Yeah,
like you're
a
giving a
new
second
life.
chance to live.
Yeah, I've known some people, they've sold everything and they just go, "Up, I'm gonna go around the world." Or they've moved. They go, "Oh, I don't want this old house anymore. I want to downsize. I want to live close to my grandchildren because my grandchildren bring me life." Or my siblings or my parents. So there's sometimes a really important choice about maybe some part of your life that you've been putting off.
Yeah, because you might think there's just a limit of time and then you want to do
Exactly.
more and
People
or
to the presence.
but actually probably after your feelings or your mind got pivot or then it also helps with the positive energy. It helps you to live even longer than you can
Mhm.
imagine.
A reason to live.
Yeah.
There's been people that I've worked with that it's like going, oh, they've been in remission for 20 years and something will pop up. Cancer patients or, oh God, I've got this feeling over here in my body here. Oh, is it what? Oh, what's this? There's always a little bit of what I would call hypervigilance, where you're looking out for so many signs. Oh, is it back? And that 5 years is such an important marker for cancer diagnosis and treatment and recovery. That's
Yeah.
why oftentimes physicians will put patients on medicine post.
What's so significant about the 5-year marker?
I think if you think back in your life, a lot of 5-year markers are important.
Yeah.
5 years since this, 5 years since that, been married for 5 years, divorced for 5 years, the child's five. There's just something about 5-year
Yeah.
marker in particular in breast cancer.
And you mentioned the length of that people have to think about, like it almost like the hypervigilant. You have to constantly notice little bits parts change by your body. But also, it's not just, oh, I go through this chemo and then it's done. It could be
No,
like
it's not
20
done.
years. That's like your whole life.
Yeah, and in the surgery post-treatment, if you go that way, every 6 months, every year, you're gonna be tested. Markers, what are the markers? Some women and men are gonna go through contrasting PET scan to make
Mhm.
sure that there's nothing else in the body.
It's almost like changing a lifestyle. You learn to live with it. It's part of you now. Maybe after 5 years, it's a celebration. It's still okay. You are going to be okay.
You're gonna be okay for now. Breast cancer sometimes is just one of those, like prostate cancer, but breast cancer is one of those ones that likes to jump ship and metastasize to other parts of the body. So it just happens.
And I guess if we get philosophical here, it's not that if you are diagnosed with cancer, then your life is uncertain. Like in any cases, you don't know what's going to happen in your life. You don't know how long you are going to live. But then having something is just putting things in perspective. Oh, there is this reason. But if we, even without that, life is just most people going on with their life, not having to think so much.
Right.
So
Yeah. And breast cancer, other cancers, certain disease processes, let's be honest, we all have a ticket on the train.
true.
We're not going to get out of this life not dying. This is what happens. But for people who've maybe gone through really a lot, I'm thinking about my dear patient, people that I've sat with in their dying time. What I say is I go, but their ticket is punched, went away. And and I've had just some amazing, I'm thinking about this one particular woman who I just adored. She had so much humor about who could and couldn't come to her memorial because she was still really mad with her ex who dissed her, and nah, he can't come. And so there's some way where there's just a very deep humor that can happen because what else can happen, really? There's something so human about telling the truth and then laughing about it,
Yeah,
you
it's
know?
the humor, but then it's also truth. But like it just sometimes the truth is funny because it's so hard. But then if you
Yeah, it's so
switch
hard.
the attitude, you
Yeah.
like you
Yeah.
that's a way to go through. I want to ask if this happens, like what can people do? Is there any resources? I did a bit of resource research and I know like for example, there is like a lot of groups people can join, like National
Hmm.
Cancer Foundation. There's a lot of nonprofit and locally, but also for example in Bay Area, there's UCSF have cancer support group, Bay Area
Hmm.
Cancer Connection. There's a lot of
Incredible.
resources that I think
Right.
Elizabeth, you mentioned like local gyms, all different like facilities. They might have like groups that supports
Mhm.
cancer. You just need to like look for it and reach out.
I think that there's also within the medical model, there's also alternative medicine groups so that there's groups sometimes. I know that there was a time when you'd get free acupuncture, massage, you'd get lymphedema massage, haircuts, gym. It's like going, there's a plethora, but you have to not just sort it out, but most hospitals have what is a nurse navigator that will help navigate some of this and will have those resources and how important it is to be received of going, oh, okay, there's going to be a writing group just for women or people going through breast cancer or a yoga class so you can reacquaint yourself with your body. Certain people who are going to massage you, you
Mhm.
know, that they know how to do that and they don't have any shame about touching your body.
Mhm.
And then there's such a huge need for couple therapists that will help the couple navigate what it is when your partner is going through this and that whole identity change.
Because it's definitely impacting the couple, not just the
The couple,
woman. You want to help, but you don't know what to
children,
do.
some people actually have guilt of I was going through cancer treatment and my child was 6 months old or 2, and I just couldn't give that child what they needed because I was trying to save myself. It's many layered, and for women and men to have places to be able to express and go through the layers
Yeah.
and to thrive. I mean, there's the survive, but to thrive.
It's very important.
From your perspective.
With TCM, what I used to do, it's we wouldn't encourage patients just use traditional medicine because with the technology now, of course, we work hand in hand with Western medicine. So whatever they need surgery, chemo, or radiation, we work with them. And there are certain ways and certain stage that what we do, either acupuncture or herbal medicine, throughout if they have pain, we use acupuncture to help with their pain. And if a lot with the side effects like feeling nausea, vomiting, or like feeling fatigue, if they're open with herbal medicine, like especially in China, we use herbal medicine a lot. If they're having cancer and going through chemo, we know which herbs to use not to contradict with their medicine. Also, if they're doing hormone therapy, there are herbs that will affect their hormones. So that's when we need to put into consideration what to use to avoid that. And usually, with a lot of doctors in Beijing, they do treat cancer patients, not only breast cancer, but all sorts of cancers. With different types of cancer, we have different protocols. So we'll see what their conditions are, and that's what we do.
So there's like alternative medicine that can help to impact the side effects. There's psychological, like from psychotherapist perspective, a lot of tools that can help patients to deal with like how their identity change and how the impact on their family dynamic. And then you have a lot of different other alternative medicine and also like Western medicine that can all need to help. And I think like from the patient perspective, like asking for help and realizing this is something big and then you
Yeah.
out for help.
Yeah,
That's
there's
important.
one more thing I put aside that came back here is that when I'm thinking of one particular patient I worked with, her crisis came when her treatment was over because she was in relationship to all her caretakers. She was a patient. She knew herself as a patient. Get ready for surgery and chemo and radiation, and then go for every 6 months, blood tests, markers, first mammograms, things like that. But her crisis was, who am I now? I'm not a patient anymore. Who am I? And that was a whole opening in me of going, it doesn't end, and that everyone has their different junctures.
It
So
doesn't end. And you mentioned like before you work with someone who after 20 years, they recover from cancer, but then after 20 years doing some tests, then you find out that they had cancer 20 years ago. So it has very profound impact. And
I may be working with somebody in my practice. And they didn't come to me for cancer treatment. They just came to work on some other things. Along the way, it's like, oh yeah, I had breast cancer. Da, da. And I go, how are you with that? That feel pretty clear for you? And some say, oh no, it ended my marriage, or it was the worst time in my life, or I feel so blessed. And someone said, I feel so guilty because I got away with a lumpectomy and other women didn't. So what am I supposed to do with my guilt?
so it could
So
be thing.
we are complex human beings.
How do you deal with that guilt if she got away with that?
A total surprise. It's, oh, my sister or my friend, they didn't get away with that, but you couldn't even tell that my breast is any different. In some ways, there's something about accepting our own lot in life, our own journey. This is your journey. That was their journey. Just that you have guilt, that you feel that compassion for everything that your best friend or your mother or your sister went through. On the most part, it's an opening. Just to hear that your father's sitting around with other men talking about their prostates, it's like going, oh, yeah, it's like you
Yeah.
want to be a fly on the wall for that conversation.
He just told me like it's nothing. His friend has that same condition and he was just sharing his experience. I went to this doctor and then did this and now I'm okay. So probably you can go check again and he feel like he's an expert now.
Yeah. Yeah.
I think that's a great ending, which we end with the fact, yes, can
There's a
reach
lot of
out, but
resources.
it doesn't mean like you're going to have the same experience like anyone else. And there's an
Right.
impact on like on you. It could happen in the when you first diagnosed and you are going through many different stages. Everyone is going through a very unique and a personal experience. Thing is wrong. You can feel anything
And it's always changing
human.
from when I was first in this field working with breast cancer to where it is now. It's like everything is different. We don't just do mastectomies, it's just different. It's ever changing.
You mentioned the procedure changes, there's new technologies that support it. So it's hopeful we're open to experience a very personal experience.
Yeah. And the targeting, depending on what the diagnosis is, and again, there's many different levels of diagnosis, just that whole part of being able to target with this combination of chemo, the whole field has changed and become so much better. And treating, we're still treating a lot of cancer, not just breast cancer, a lot of cancer. And we're just hoping that it's just going to get better and better.
True. Yeah.
And the resources are there. We don't have to keep it between the four walls, between just our doctors and ourselves, and that we actually become advocates. The good news that I see is that women and other people talk with one another. Oh,
Mm.
what happened to you? Oh, what was that like? Everyone's got their own story, and we become more part of a community.
And sharing your personal story, being vulnerable is a way to
Mhm.
be strong.
And becoming advocates. Like this woman who just got diagnosed, her particular physician or the hospital don't have a lot of resources. So now I want to hook her up with some possibilities so she
Yeah.
doesn't have to feel so alone.
That's
Yeah.
wonderful. I think there's a lot of resources, but it's also too much information. Sometimes talk to people, like it's try out different, just see what works for you because it's very personal. The experience is personal, also the treatment should be customized. But thank you so much, Elizabeth.
Thank you for finding me. It was like a needle in a haystack in the middle of LinkedIn. And
Yeah.
to meet the two of you, it's just been quite a joy.
We're really grateful that we know you now, meeting
And
you. And by all every time talking to you, it's very inspired and very touched.
it gives me, oh, this is why we want to do this because we want to talk to you and to learn
Mhm.
about stories. Because you have such a rich experience and you want to help people. So that's something that just touches me.
Yeah. And that's what the two of you are doing by forming your podcast, was to try to get our stories out. I
Thank you.
commend you as well.